Hello, my name is Dr. Lorian Pratt. I'm Chief Scientist at Quantellia. We're a company that builds a software product called World Modeler. World Modeler helps to simulate important decisions in the world, and today I'm going to tell you how it can be used to understand policy decisions in disease control. In this particular instance, we're going to illustrate how World Modeler can be used to understand the cycle of disease around HIV/AIDS. If we can imagine that in a particular country that's beset by HIV/AIDS, sick people have a negative economic contribution, healthy people have a positive economic contribution, and we might make various policy decisions about how to address these sorts of issues. The World Modeler tool helps us run a simulation to understand how disease might play out in a particular country. If I press the simulation button, you can see that the GDP in Angola is rapidly lowering while the infection rate is exploding to quite a high level. We can fundamentally change the course of a disease through different policy decisions. What we're seeking is a situation in which a negative spiral of disease is turned into a positive one, in particular where more and more productive people produce a higher GDP, thereby freeing up more dollars to spend on health care. As it turns out, simple policy decisions can shift us from one of those extremes to the other. So let's imagine we're in a slightly different country. We'll move to Namibia here. And we have a similar negative economic impact of an infected person. We have a similar higher economic positive contribution of a healthy person, similar amount of our health budget spent on AIDS prevention, and a particular training cost per practitioner. In this country, however, we're going to make a slightly different choice. We're going to choose to divert some of the funds that would otherwise be spent on medicine to training doctors to ensure that that medication is administered successfully. That diversion is represented by this movement in this yellow bar or the blue bar that I've moved up and down here. And so in Namibia, this slightly different choice we'd expect to lead to slightly different dynamics in how things play out. If I run this simulation, you can see that this is indeed the case. Observe with Namibia, we see a slowly increasing GDP. The infection rate went quite low, and what you can see is that the total population is now steadily growing as the GDP for the country overall changes. Now, this was just the result of a single policy shift. What we realize is that in this particular circumstance, the ability to have doctors who are well-trained catalyzes and improves the efficacy of this particular drug. In a real situation, we'd have a number of choices that we face, including public health campaigns and other efforts that help to ensure that AIDS prevention is as effective as it can possibly be. What a decision model allows us to do is to understand and experiment with the impact of these various policy decisions, in particular to understand exactly where's the tipping point where we can shift from a negative cycle of disease to a positive cycle of disease, as we've seen here, where more and more people become productive, thereby increasing the overall GDP. Part of that is used for health care, which in turn helps to cure more of the population. This is the situation we're aiming for, and it's very important to use these kind of simulation tools to understand how various policy decisions can impact a country. Thank you for your time looking at our World Modeler tool today. Again, my name is Lorian Pratt, and I'm with Quantellia.